Hello, hello.
Yeah, madam.
Ama, you have joined.
Uh, yes.
Uh, any other people apart from Madam? Any others are in connection?
Yes, ma'am.
May I know who is this?
Yes.
Krishna.
Krishna. Okay. Anybody else?
Yes, ma'am.
Anybody else is there? No. So we'll just start the class on the Unani medicine, right? It is again a part of the syllabus from the fourth chapter, that is alternative system of traditional medicines. And this Unani medicine is otherwise called as Tibb Arabic medicine. So this Tibb medicine is the science in which we are going to learn the various states of the body, either in health or not in health. That means the health is if the body condition is restored, and the disease is considered to be when the body condition is not restored. That condition is called as a disease. So this was a principle told by Wu Ali Senna, one of the Greek physician. And when you just see the Unani system of medicine, Unani system is originated in Greece. And this system was developed during the Arabian civilization. In Europe, this system of medicine is called as Arab medicines. The Unani system of medicines, the physicians, they have taken the reference from the findings of Hippocrates. You know very well who is the Hippocrates. He is a father of medicine who lived in the 460 BC. When you have seen about the history of pharmacognosy, we have seen in detail about the Hippocrates, Aristotle, Dioscorides, and Galen. So Galen was the first pharmacist, and he has contributed a lot to the medicine. The contributions of Galen was called as Galenical pharmacy, and this was used as a reference book for most of the physicians. And this Greek medicines, they were also further added in Unani system, and they have used these things as the reference. And in India, the Unani medicine was introduced by Arabs and Persians in and around 11th century. In Ayurvedic system of medicine, if you see further in the later findings, the Unani system was also been added. And when you just see the theory and basic principles of the Tibb or Unani medicine, basically it is based on the four humors of Hippocratic theory, and also in connection with Pythagorean theory of four proximate qualities. Before that, we should know what do you mean by the four humors of Hippocratic theory. That is nothing but the blood, the phlegm, the yellow bile, and the black bile. You can see in the screen the Arabic words for the blood, which is spoon, for the phlegm it is balgam, and for the yellow bile it is saffron, and black bile sauda. These are the end product of the digestion, and mainly they also regulate the various functions of the body, especially when you see your blood or the bile, which are helpful in maintaining the functions of the different parts of the body. And next, when you see about the Pythagorean theory of four proximate qualities, that is the state of matter. And these qualities are basically depend, or they are the cold, hot, wet, and dry moistures, that is the air. And these two together, that is the Hippocratic theory of four humors and Pythagorean theory of four proximate qualities, they associate together and give the combinations. When you just see the earth and water, that is the two basic elements of the Panchamahabhutas, they develop the organs. This already we have seen in the discussion on Ayurveda. And air and fire, the next two elements of your Panchamahabhuta, they produce the energy. And here you can see the correlation between the proximate principles and the elements of Panchamahabhuta. Hot and moist, which refers to the air. Hot and dry, which refers to fire. Cold and moist, which refers to water. And cold and dry refers to earth. These proximate qualities and the inherent elements of Panchamahabhuta, they are in interactions with each other. When they interact with each other, they will exhibit the quality of a person. That is nothing but the temperament. In Arab word, it is called as mizaj. And there are about 9 types of temperaments. That is the 9 types of mizaj based on the qualities and combinations, and viewable, that is mutadi. As per the temperament, the personalities will be differing from one to another, and the different proximate qualities are called by the Arabic words differently. Hot, which is called as mijai har, and cold, mijaz e barat, dry, mijaz e yabas, moist, mijaz e rat. And when these humors, that means if it is normal, they say that the person is said to be healthy and he is in a good mood. And he is also assigned the temperaments. When you say blood is hot and wet, and phlegm is cold and wet, yellow bile is hot and dry, and black bile is cold and dry. When you see the phlegm, it is cold and wet. It is thick, stick and stringy mucus secretion by the mucous membrane of the respiratory tract. So that's why when we are affected with the cold or respiratory infections, we get the phlegm. And the yellow bile, it is hot and dry. It is associated with hot and dry. It is yellow in color sometimes, or greenish viscid fluid, and it is slightly alkaline in nature, which is secreted by the bile ducts in the liver. And then it passes on to the intestine, where it aids digestion. That is already you might be very well know about the digestive system, how the bile is helpful in digesting the lipids. That is, it is somewhat brownish or greenish fluid which is secreted in the liver, collected by the bile ducts, and it is drained into the small intestine, where with the alkaline pH, it is making the lipids to get coagulated and helps in the micelle formation, and thereby the breakdown of lipids is easier. So you can just correlate whatever you have studied in the anatomy or physiology of your body with these things, not only with the Unani system, right from the Ayurveda or Siddha or homeopathy or whatever it is. The next proximate principle is bile is cold and dry. This is a humor that was once believed to be secreted by the kidneys or spleen, and which is the reason for the sadness. That is again a temperament, a type of temperament. And the fourth proximate principle, or the collectively the four humors, if they are in the correct proportion, they say that a man is having a perfect health. If there is any deficiency in the humor, or the plethora or the imbalance in the humor, or due to the external factors, that is the antigen which enters into the body, and thereby it produces the infection, which is otherwise called as the cardia. These all will influence the changes in the humor, which results in the occurrence of disease in the man due to the imbalance. And when you just see the diagnosis of the diseases in Unani or Tibb medicine, Hakims and the physicians, they diagnose the patients by observing the pulse, the sputum, urine, and the stool. So already when I am talking to you about the Ayurveda or the Siddha, all these things are taken into account when the physicians are diagnosing the diseases. And apart from observing the pulse, the sputum, the excretory products like your urine or stool, the physician also needs to see about the patient's psychology, the age of the patient, sex of the patient, what kind of habits they are having, and also they have to collect the family histories, the hobbies, the occupation, and the working conditions. So based on all these things, the disease can be diagnosed by the imbalance in the humors. And next, once after the diagnosis of the disease has to be treated. So how the treatment is done in this Unani system of medicine? The root cause of the disease has to be treated, not the symptoms. So to treat the root cause of the disease, the treatment can be done in two ways. The first one is we have to try to remove the root cause, and secondly, we have to strengthen the defense mechanism of the body to prevent the recurrence or relapse of the disease. And what do you mean by a disease? We just come from the backward thing, that is the products of digestion. When it comes out, if it is not proper, the humors, that is the imbalance in the humors occurs, which results in the occurrence of disease. So what we should do? we have to regularize the diet in order to remove the toxins which are going to be accumulated in the body. Then, by removing the accumulated toxins, we are going to restore the humor balance. When we are restoring the humor balance, the immune system of the body is getting strengthened up, and the body is made available to prevent the relapse or recurrence of the disease. And apart from that, if you want to strengthen your body, or if you want to improve the immunity of your body system, the as I already told you, the physical, mental, and emotional health is also to be put into the equilibrium. So, how can you help to put the physical, mental, or emotional health in the equilibrium? By subjecting these different criterias to the simple kind of exercises, the inner health can be promoted. And apart from that, the one more thing which is included in this treatment is massage. So this massage is done for toning the nervous and the circulatory system. So if we do all these things together, the disease can be treated in the Unani Tibb medicine. So these are all the formulations, the marketed products of the Unani Tibb medicines. I just given for your reference to go through. And so this is about the Unani Tibb medicine, which is the otherwise called as the Tibb Arab medicine. And nowadays, this Arab medicine or Unani medicine is not much followed in our country, that is in India. In India, we follow mostly the Ayurvedic system of medicine, Siddha system of medicine, and homeopathic system of medicines. And as I already told you when I was talking to you about Siddha, the government of India under Ayush, they are controlling nowadays the people to get the degree and to get or to do their practice in their uh, respective disciplines, that is maybe in Ayurveda or Siddha or homeopathy. Okay, so here we stop this discussion. And anybody having doubts, or are you clear with these points? Yes, not able to join?